Who's NHS? Who's NHS?
We are told by people we can't afford the NHS. We can't not afford the NHS. Our message to the government is easy. You bailed out the banks, bail out the NHS as well.
The Tories and the coalition before them managed to cut taxes on big business. They cut taxes to the richest families. They cut taxes for the speculators. Cut taxes for the fat cats. Don't let them tell you there's no money for their NHS. There is no excuse for it. The money is there if you collect the taxes properly to fund it and pay for it.
The purpose of today has been to bring together health campaigners, NHS workers, our trade unions and community fighters around three clear demands. Number one, no cuts, no closures and no privatisation. Number two, an end to pay restraint for NHS staff. And number three, for a fully funded, publicly owned, publicly provided national health and social care service.
NHS workers have undergone an age of pay restraint which has lasted longer than the Second World War. We have had a 14% real terms pay cut since 2010, so no wonder there are 35,000 nursing and midwifery vacancies in NHS England alone. On Wednesday we can expect our latest pay award. I for one am not optimistic about it, but if we are served up more of the same 1% pay cap, which is forcing people out of the health service in their droves, then our trade union leaders will have no option but to ballot their members and coordinate industrial action.
We're here today for a national demonstration in defence of our health service. I think it's going to be a really big demonstration, and that's fantastic, but it can only be the start of a movement to save our health service. We all know the NHS is on its knees. Anybody who's been to casualty and queued up, who's tried to get treatment, realises how overstretched and under-resourced the NHS is now. But this government want to make it worse. The STPs, which they dress up as redesigning the health service, are really slashing, trashing and privatising our health service. They will mean £22 billion worth of cuts by 2020 out of the NHS. And have no doubt, this government don't support the idea of an NHS. They don't want a health service which is free at the point of use for everybody. They would like us to have an American system where they check your credit card and your insurance before you get treatment. We have to fight to prevent that happening, to stop the cuts to the NHS, to kick out the private companies that are already making big profits out of our National Health Service. And unfortunately, that was expanded massively under New Labour and has then been continued by this government. Today's demonstration is a start, but we need to do more. The trade union movement should use their 6 million members to mobilise a massive demonstration, even bigger than today's, in defence of the National Health Service. But we also have to be prepared for strike action, coordinated action, striking together to defend our hospitals, to prevent hospital closures. That's the kind of movement we need to build. Today's demonstration is a fantastic beginning, but the Socialist Party will be doing all we can to make sure that it is just the start.
And here we are, in this truly historic moment, the largest demonstration to defend the NHS to date. And why are we all here? Because in spite of sustained pro-cuts, pro-privatisation offensive, the NHS remains pound for pound the most efficient way of providing care for the sick and the vulnerable. Successive governments, driven by a profit-seeking agenda, have sought to undermine and ultimately destroy the NHS. They have felt threatened by the principles of the NHS. Everybody pays in what they can and takes out what they need. These are the socialist principles that our forebearers fought to enact when they built the NHS out of the ashes of the Second World War, and it is these principles that we as a movement need to stand together to defend.
It's not for magic! Keep it public! I'm Dr. Phil, thank you very much, good night.
I think he said good night to you all then.
Too much touring.
Thank you very much. We have about 7 or 8 more speakers.
I'm Mike Forster, I'm chair of the Hands Off HRI group from Huddersfield, and I've also joined the Health Campaigns Together steering committee, which together with the People's Assembly has called this demonstration. On the 10th of October we came to London for a smaller protest and decided to call this demonstration in October and convince the steering committee of Health Campaigns Together this would be a good idea. To be honest, this protest has mushroomed beyond all proportions that we originally expected. And that's because of 2 things. One, the enormous crisis that's now engulfed the National Health Service, which is suffering from chronic underfunding. But also because of the cuts that the government are intending to impose, which will be £22 billion over the next 3 years. That will go from 8% of gross domestic product that this country spends on the NHS down to 6%, which will be the lowest in Europe. This is a crisis of massive proportions, which can only be resolved by local campaign groups uniting together with the trade union movement and concerned people who want to save the NHS to put so much pressure on this Conservative government that they're forced to change course. What we will be demanding of those councils who have been consulted about these cuts, that they chuck out the sustainability and transformation plans to ensure that they're not implemented. We're calling on Labour and the TUC to call another bigger demonstration later in the year. This has come from the grassroots and has been organised by ordinary people with scant resources. But with the full authority of the Labour and trade union movement, we could call out 2 million people in defence of the NHS. And of course we will be supporting those unions that will need to coordinate strike action to stop hospital closures, to stop the cuts that are being imposed by this government, and to support those people who are fighting to save the NHS. This demonstration is the start of a huge movement. It could end up being the Tories' poll tax, given the enormous support that there is for saving our National Health Service. So I therefore trust that today we will be able to send out the call and gain support for building the biggest movement this country has seen since the days of the poll tax.
Our message to the private health company vultures is a simple one. Keep out of our NHS, you thieving Tory bastards, because we will fight you all of the way. Sisters and brothers, keep the faith and keep fighting for what is ours. Thanks for being here.
The Tories are determined to destroy the National Health Service, but actually their attempts to do so could see them thrown out of office. We shouldn't forget this is a very weak government with a tiny majority. Only 24% of the electorate voted for a Tory government. None of them voted for Theresa May as Prime Minister, and the National Health Service is enormously popular. So if we can build a movement, then we could force them, we could defeat them on the National Health Service, save our health service, but also force them to call a general election. It's really good that Jeremy Corbyn is here today speaking at and supporting the demonstration. But we would say to him that Labour councils have an important role to play in defending our National Health Service. All 44 STPs have councils signing up to them. If every Labour council was to say, we reject the STP, a few have already, but everyone up and down the country, that will put the whole plan into jeopardy. And Jeremy should be calling on Labour councils to do that. We also fully support his demand for the renationalisation of the NHS, for the kicking out of all of the private companies. The PFI companies that are making a fortune, bleeding our NHS dry, should be sent packing with no compensation to the big shareholders who are making a mint from our health service. We would also go further. When the NHS was set up, it was, if you like, a little bit of socialism, introduced in this country under the pressure of ordinary working class people. But we want more. The pharmaceutical companies were left in private hands and make billions out of our National Health Service. They should be brought into democratic public ownership as well. We want a socialist health service as part of a democratic socialist economy. We say the NHS should be in public hands and should be run democratically, involving the staff, the trade unions and the users of the NHS. If you agree with us, then join the Socialist Party and help us build a movement to defend our National Health Service.
At Huddersfield Square, we heard from the leader of Hammersmith and Fulham Council, where they reject the cuts package implemented by their STP. Now, with the leader of the opposition present, it would be remiss of me if I did not ask him to write to every single Labour council, calling on them to follow the lead of Hammersmith and Fulham and reject the government's STPs outright. This is not a single fight affecting only one group of workers. This is a battle to defend our greatest ever collective achievement. The 1st of May is a celebration in the workers' movement. Let's make May Day a day of action across the country in every community to defend the greatest victory of them all, our NHS. Today we have made history by marching together. We may well have to strike together. Let's stand together and fight for the service that we need and deserve. Thank you.